Without further ado, let's go ahead and start. So, welcome everyone. Uh, Parents, they hear very mixed. Parents and other people also, they hear very mixed messages about timeout, and that can make this topic feel confusing before we even start. Many people, they have different opinions about it. So my goal today is not to push one discipline tool on every family or therapists as well to use that. It's more to help you understand what careful research says about it and what healthy use looks like, and when timeout may not be a good fit for your client, for your learner, for your child. So as we go through this, I want you to listen for a few themes: calmness, predictability, connection, and teaching. Those are the pieces that matter the most. The label matters less than how the child experiences the response. So next, I will briefly share the length that I will bring to this conversation. So for some of you who don't know me, I come from a behavior analysis background. I'm a board certified behavior analyst. I'm also a licensed board certified behavior analyst in UAE. And I chose this topic because I spent years helping families sort through everyday behavior challenges in real life. It's not only for autistic children, and not just in theory, in practice as well. So most parents, they are not looking for perfect answers. They want clear guidance. They want practical tips and tools and approaches that they can implement immediately, that can give them the desired response or the desired outcome. And they want to protect the relationship between themselves and between their kids as well. And this is the, let's say, the spirit of this presentation. I'm not here to judge. I'm not here to judge anyone, any parent, any teacher, for what they have tried in stressful moments. I'm here to separate internet opinions, and we will see some videos about that. So to separate internet opinions from careful evidence, and to give you a practical way to think about timeout. So before we look at the studies, I want to share with you what you will take away from this presentation today. So by the end of the session, I want you to feel less confused and more confident. You don't need to become a researcher to benefit from this information, and you don't need to be a behavior therapist also to benefit from this information. What you need is a clear picture of what timeout actually is, not what your friends told you what it is, not what other teachers tell you what it is, other parents, they tell you what it is. It's what the research tells us what it is, how it is different from harsh or angry versions, what the research suggests, and what questions to ask before using it. I also want you to leave with a more balanced view, because for many families, the real issue is not whether timeout is always good or always bad, or does it work for them or it doesn't work for them. The real issue is whether it's being used thoughtfully, calmly, not in an angry way, and as part of bigger presentation, a bigger parenting plan. So let's start with this topic, with why this topic matters so much to families at the moment. So this topic matters because parents are being pulled in opposite directions. One person says timeout is important, it's essential. Another says it's harmful. You will see a lot of parent coaches now on social media advocating and preaching about that, whether they are with or against. So social media often turns a complicated issue into a simple slogan. And parents, they are left trying to make decisions in the middle of that noise. And the truth is that discipline affects more than behavior in the moment. It also affects trust, it affects emotional safety and the overall tone of family life. So it makes sense that parents care deeply about getting this right. You do want to get this right. So the good news is that the research gives us a more helpful answer than either extreme, whether it's completely bad or it's completely good. So first, we need to be very clear about what we mean when we say timeout. What do we mean when we say timeout? Okay. So there's a lot of confusion that begins here. People use the word timeout to describe totally different things. In research, timeout refers to a brief, planned break after a specific behavior, delivered in a calm way and in a predictable way. So it's not meant to scare the person or the child. It's not meant to shame the person, to isolate a child. So it's also not a response to fear, pain, accidents, or a genuine overwhelm. That's not timeout. You should be using timeout. And we'll see more about that. So when parents say timeout does not work or that it felt harmful in their own childhood, let's say their mother put them in timeout. They used to tell us back in school, I don't know about you, but they used to tell us in school, we will put you in a room filled um, with rats, those big rats, right? As fear. Um, so when parents say timeout, it doesn't work. They refer to their own childhood, or they may be talking about something very different from the careful version that is studied in research. So before we ask whether timeout is helpful, we have to define it very well. And if you are in the ABA field, you know about operational definition. So every behavior that we want to analyze or change, we do need to define it well first. So once that is clear, then it makes more sense why people disagree so strongly. Okay. Now, people disagree about timeout partly because they are not always talking about the same thing. This is where operational definition will have everyone talk about the same thing. Some criticism is aimed at harsh or angry versions. And those concerns are valid. They are real. We're not saying no, but they are there. So some support is based on calm, structured use, which is a very different experience for a child. Research, however, also vary in how they define and measure timeout, which adds to the confusion. On top of that, headlines often they the headlines they are catchy. They have to make them catchy to get more views, more clicks, more all these things. So they are using different um, strategies for that. So real parenting is rarely that simple. It's not either good or bad. Also, family culture plays a role, child temperament, and the way a parent follows through, that all matter. With that in mind, we will look now at the larger parenting context because timeout should never stand on its own. It shouldn't be a standalone treatment package or a parent approach. If there is one idea that I want you guys to remember, it's this: timeout is not the main plan, as we said. It's not a standalone procedure to follow, whether you are a parent, a teacher, or an ABA therapist or any kind of therapist. So the main plan first is connection, teaching, praise, routine, and clear expectations. Those are the main focus, which we can summarize it into pairing if you are familiar about pairing in ABA. So timeout only makes sense if a child already experiences daily life with you as warm, supportive, and predictable individual. So even if you are the therapist of that child and you fit this criteria, then it makes sense to implement um, timeout in an effective way. That also is a clinical decision. If most of what a child gets is correction, which most parents they do, then timeout will not lend you will not have the same way and may only add more stress. So if you implement timeout and you already give a lot of corrections, it's not going to have the same effect as if you are a supportive person, a calm person, a warm person, predictable person for that person, it will land differently. So children need to know what to do, not just what to stop doing, which this is what we're trying to change as behavior analysts and behavior therapists, is to tell the parents that and other teachers that children they also need to know what to do, not only what not to do. I was walking the other day in the mall and I saw a mother with her, I think he was like around 4 years old. She was always using correction statements. Don't touch this, don't do that, don't run, stay next to me was actually good. But that 1 out of 5, it was all don't, instead of what she wanted him to do. That's why positive attention and teaching come first. Okay. If you have any questions during this presentation, you can either click the hand raise, or if you would like, we can keep it till the end since, as I mentioned, we are a small number of people. Thank you for everyone who showed up. So we can do questions in between if someone cannot wait. Okay, so now that we have the foundation in place, let's look at the first study and what it adds to this conversation. This is back in 2011. Okay, so this first paper was important because it stepped back and asked a very basic question. Is timeout itself the problem, or is the problem how people are using it? And what else can you relate to that question? I can relate the ABA field. Is ABA, the science of human behavior, is the problem, or the problem is the people who are using our science in a very bad way? So the authors of this study reviewed the evidence that existed at the time and looked closely at how timeout fits inside a broader positive parenting approach, not as a standalone approach. So already parents, they were doing a lot of positive parenting stuff, and then they were looking at doing timeout. So as we said, that matters because many public criticisms, they were treating all forms of timeout as they were all the same, but they're not the same. So the value of this paper is that it brought the conversation back to definitions, as we mentioned, operational definition, context, and quality of use. In other words, it asked us to be more precise, which is why when I have someone saying this family or this person uses timeout, I say, do they have behavior analysis background? Because what we do in behavior analysis, if you are in this field, you will understand why we have a different perspective than other educators and other professionals, because we understand behavior from a different lens than they do. And because we have operational definition, we are more precise. We have everything with data. So precision helps explain the findings that we're going to see on this slide. Okay. So the big takeaway from this research is that careful, calm timeout can be helpful, but poor use of timeout can be harmful, just like most of everything else. You use it properly, you get the desired outcomes. You misuse it, you're not going to get the same outcome. Just like when you take 2 pills of Panadol, for example, for your headache. The recommended requirement is 2 pills. If you overuse it, you're going to harm yourself. So that may sound simple. Now, we're all calm, we're all in this, let's say, in this area. But as soon as the heat comes up and you have a child who is misbehaving, it's not going to be that simple. So the key to understanding the whole topic is to know that support for timeout, when it is part of a warm parenting approach, is effective. And also when you teach parents how to use it correctly. We will see a video of a mother using timeout incorrectly, or you will tell me where she's using it incorrectly, and then we will brainstorm. And also, this research made an important point, which is the stories parents often hear about harm usually involve angry, inconsistent, or harsh versions. So that is not the same as evidence-based timeout. This study does not say every family should use timeout, and that is definitely not the clinical recommendation as well. It says that we should not confuse misuse with the strategy itself. Okay? So just like with medication, no one is going to tell you don't take Panadol if you have pain, right? But they tell you don't misuse it when you have pain. Okay. So let's take a look at this slide just to make it a little bit more concrete. So this slide shows what appropriate timeout looks like, okay, in practice. And notice how plain and calm it looks, right? There's a clear warning, there's a brief follow through, and there's a short timeout, and then there is reconnection. So memorize this, or take a screenshot, or write it down, or however you want to take notes. So there is nothing dramatic here. There is no overcorrection. There is no facial expressions that are exaggerated, or loud noises, or shouting from the parent. So the child is not being humiliated here, okay? He's not being frightened or banished or isolated. The message is very simple. Behavior is not okay, and we're taking a short pause. So that behavior you're doing, we can't allow that, or that's not acceptable, whatever that is, we're going to take a short break from that. So the end of this timeout also matters as much as the beginning. So after the brief timeout, the parent reconnects and helps the child move on, not reflect on what happened. Move on. You can reflect later. So that's a very different from turning the moment into a lecture or a power struggle. This is where a lot of misuse of timeout is. Let's say they give the warning, they did the follow through, they gave the timeout. This is where they stop. And that's where the long lecture and they try to put logic in the brain of the child. They have that power struggle. Are you ready? Are you listen? Are you willing to listen now? All that back and forth. Not yet. Okay. So when parents miss one of these steps, problems start to happen. They start to happen again. And that brings us to the most common mistakes. Parents often do not mean to misuse timeout. So as behavior analysts, we know that parents also lack skills when it comes to behavior and other things. So it's not that they want to misuse it, they just don't know how to use it. Just like a child doesn't know what to do, he has to be told what to do. Parents and teachers and educators and other professionals also, they don't know what to do. They need to be taught how to do. So how do you use timeout and you don't misuse timeout? And usually it happens because they are tired, they are stressed, they are overwhelmed, They're trying to respond in the moment without a plan. Most parents don't have plan. Most parents are not trained in behavior analysis. And that's where we come in to help them understand that your life is not supposed to be like this. There is a way that's not common because parents, they also get affected by other parents. It's normal for kids to misbehave. It's normal for kids to do like that. Actually, no. Okay. So the most common problems are using it in anger, being inconsistent. So sometimes you use it, sometimes you don't use it. Talking too much during the timeout, or using it for behaviors that are really signs of distress, overload, or immaturity. So like a meltdown, not as a tantrum, like a meltdown. A meltdown is overstimulation. Don't use the parent should not be using timeout. So those missteps, they matter because they change what the child experiences. So instead of a short, clear pause, the child experiences confusion, rejection, or unpredictability. Like, why did you put me in timeout? What did I do? I got overwhelmed. I couldn't regulate myself fast enough. So I go to timeout and now I'm the one who's confused and rejected. So this is when timeout starts to lose its value and may even make things worse. And that's where parents will say, I tried timeout, it didn't work because it wasn't the right approach. It didn't solve the problem. Now, the next study is a more recent one, is helpful because it looked directly at child well-being, also at the relationships and the adversity, which are some of the parents' biggest concerns. Let me see if I can try to launch a poll. Okay. Okay, so let's do number 1 and 2 for now. We should have separated these things. Okay, that's fine. Okay, some of you are answering. No problem. It's fine. That's okay. What best describes your view? Yep. Yes, we will talk about that in the next few slides. Thank you for that question. Keep it in mind, please. If it wasn't answered, we will talk about it. Okay, so mostly helpful. Sure, you're most welcome. Depends how it's used. Yep. What matters most in whether timeout is appropriate. Child age, how calmly and consistently it is when a positive plan. Yep. Okay. So for number 2, there is no specific correct answer. But the strongest answer is how calmly and consistently it is used within a positive plan. Okay. Um, all the other ones they can be correct, but the strongest one is the third one. Okay. Number 3 and 4, we'll just do it next after a couple of slides. That wasn't meant to be for this now. I'll fix it next time. Okay. So this is the recent study that took one of the strongest concerns, as we mentioned, for parents, and which is the idea that timeout is especially harmful for children with trauma, neglect, or other hard life experiences. So these researchers, they listened to the most common concern of parents, and then they did the study to come out with this one. So rather than relying on assumptions and other parents saying to other parents, timeout is harmful, the researchers look at how timeout was actually being used and how that related to child well-being and attachment, which is, in my opinion, is a very, very good scientific question. The important part is that they separated appropriate use from harsh or inconsistent use. That let us ask a better question instead of asking whether timeout is always bad for children with adversity, the study asked whether quality of use changes this whole idea and the picture of timeout. And the findings, they were more nuanced than many people expect. Okay. So this is the result. Appropriate use led to better outcomes. Okay. So children who experienced calm, appropriate timeout tended to show better outcomes than children who experienced harsh or inconsistent timeout. Okay. So just as important, the data did not support a blanket rule that timeout should never be used with children who have experienced adversity. That they did not support that. So if you have an idea that timeout is bad, rethink that idea after today's presentation. So that doesn't mean every child with a hard history should receive timeout. It means the answer cannot be automatic, not automatically timeout. So parents and professionals still need to look at the individual child. This is why we have individualized plans. Also look at the child level of distress and how the strategy is being used. Okay. And I have for you now the next slide, which translate that into different appropriate versus inappropriate. And I believe this should answer the question of Nusrat. Okay. Okay. Uh, Actually, it's not about the behavior. It's about how you're using it in that study. That's what they looked like. That's what they researched. It's the quality of the timeout, not the behaviors. So I like this comparison actually because it turns a research conversation into something parents they can picture, they can see. So the same label, timeout, can describe two different experiences. So in one version, the parent is calm, the steps are predictable, the break is brief, and the relationship stays warm. In the other version, the parent is upset, the response is inconsistent, the time is too long, and the child feels confused or scared. I don't know why I received the timeout. Or he got scared from the timeout. So those are not small differences. They are exactly what shape whether the strategy helps or harms. So when families say, we tried timeout and it was awful, it was disaster, my kids didn't stop crying all the time. So this is it's worth gently asking these parents what their version of timeout they actually looked, how did it look like? Which version did they use? Okay. Now, another study also looked at another perspective by asking adults, not children, adults, what they remember about timeout from their childhood. And I personally found that this research very, very interesting. So this third study looked at timeout from a longer view. So instead of studying children in the moment, the researchers asked young adults what they remembered about timeout in their childhood and whether those memories connected with how they were doing later on. So it checked, okay, that kid received timeout after 15, 10, 15, 20 years. How are they doing now because of that timeout? So that makes this study especially interesting for parents who worry about the long-term impact. And if you get a question as a teacher, as a practitioner about timeout, you know what to answer them. So definitely memories are not perfect. We don't remember every single memory. And the authors of this study also, they were clear about that. But people's memories still tell us something important about how a parenting response felt to them. So I can tell you from my personal memory that I still have memories about some things in my childhood that happened. Other people's, they might have different things. Each one, we go through different memory lane. So this is why this study adds value to the existing research about timeout. It gives us a window into the difference between a consequence that felt fair and contained versus one that felt harsh or frightening. Okay. So this is what they reported about their childhood. And what stands out here is that fairness and tone seem to matter more than simple frequency. So it's not about how many times they were in timeout. It was about, was it fair, and the tone that was used when they received the timeout. So adults who remember timeout as calm, understandable, and fair, they did not show the same pattern of concern as adults who remembered that it was harsh, it was confusing, it was not fair, it was emotionally intense. So again, this points us back to the same idea we have seen across the studies. How a child experiences the response matters. So a child is far more likely to tolerate a brief correction in the middle of a warm relationship than a consequence that feels not fair or scary or rejecting. So by this point, the message across studies is becoming uh, consistent. It's becoming clear. Okay. And this is what the three studies came out with. So when we step back and we look across all these three studies, the pattern is, like I said, a little bit clear. The research does not support the idea that timeout is harmful. So if anything you want to take out from this presentation is that don't be scared of using timeout when it is implemented appropriately. It doesn't cause harm if you use these strategies and guidelines here. It also does not support careless use. What it supports is a very specific picture, like I showed you. Warning, let's go back to it. Warning, follow through, brief timeout, and reconnect. Okay. Okay. Uh, Misuse is not the label itself. It's the biggest risk that can appear. So for parents, this is very useful. That's very useful news because it moves the conversation away from extreme positions and toward better questions. So now parents can start asking other parents if they watch uh, this presentation. They can ask other parents, how were you using timeout? So instead of asking, is timeout good or bad? The better question becomes, is this the right situation? And can I use it well? Am I calm enough to use it? Okay. Now, before you use timeout, pause a little bit. Take a moment and ask a few simple questions. Is this behavior something my child can truly control right now? Or is my child scared? Is he overwhelmed? Or is he in pain? And then, second question, have I clearly taught what I want instead? Not only what I don't want to see. What do I want to see? What is the replacement behavior? Am I calm enough to do this in a steady way? Or I'm not right now emotionally capable of implementing timeout? And is our relationship strong enough overall, not now, overall, that this will feel like a brief correction, not a rejection? Or because you did this, I'm doing this to you? So these questions, they protect parents from using timeout as a default. There is one account on social media. She uses timeout as default. Everything her toddler does, a 2-year-old, and I'll show you, 2-year-old, everything he does, she puts him in timeout. And then you will see the comments on her videos, parents supporting her, other people supporting her and saying that she's doing well and her kids are well behaved. There's a big difference between well behaved children and scared children who are well behaved. Anyways, um, okay. So once those questions are in place, then we can talk about the kinds of situations where timeout may be a reasonable option. Okay. Now, this is where timeout may be appropriate. So, timeout tends to make the most sense when the behavior is clear, specific, and happening on purpose. For example, hitting, throwing, repeated aggression after limits have already been taught. So, you taught limits about hitting, you taught limits about throwing, you taught limits about aggression towards other people, and still it's happening, then you can define it clearly, put a plan, and then you can implement it. It also works best or better when the child is young enough to understand a short pause and when the parent can stay calm and consistent. If the kid is too young, like 2 years old, is too young, because 2 year old developmentally, they still don't understand a lot of things, and especially delays and short pauses. Like, because I did this, I went for timeout. Not yet. Not yet. So developmentally, this is not appropriate to use at this age. That's one part. Yeah. The other part, thank you, Nusrat. And the other part is, as a parent, as the adult, when you are implementing or you want to implement timeout, are you calm enough? Are you consistent? Do you have the emotional maturity to implement it? If your answer is yes, then go ahead and do it. Okay. Another important piece is, like we mentioned before, and we will keep mentioning it, it's the overall relationship between you and that person. If the child regularly gets positive attention, encouragement, and help learning better behavior, then a short timeout is more likely to feel like a clear boundary rather than a loss of connection. But if a parent is all the time negatively providing attention and correction and then implement timeout, this is where harm, based on research, will develop and will happen. Even then, it is only one tool. Timeout is one tool. And there are many situations where it's not the right tool. Okay? So let's name those situations clearly. Here it is. Timeout is not a good response to everything. It is usually a poor fit or option when a child is acting from fear, from pain, from sensory overload, which is the meltdown, exhaustion. You have been all day at nursery and they have been running around, swimming classes, a lot of activities. The kid is exhausted and he comes back at 6 o'clock from nursery or 5 o'clock, and then you implement timeout because he's misbehaving, or a genuine emotional overwhelm, which is also a meltdown. It may also be the wrong choice when the child does not really understand what is expected. Like, what am I supposed to be doing? Why you're giving me timeout? I don't even know what you want from me. That's where a 2 year old doesn't know what the mother wants from him. He doesn't know. Or when the behavior points to a bigger need like sleep, hunger, connection, or skill building. Some situations simply need a fuller plan, not a quick consequence. It's easy, or it's easier to give a quicker consequence than to have a full plan, definitely, especially if you have several other siblings and kids. And sometimes the biggest signal that timeout is not the answer is that it keeps being used without improvement. She puts him in timeout, he does it again. She puts him in timeout, he does the behavior. Tomorrow, she puts him in timeout. After tomorrow, next week, it keeps happening. Then that means timeout is not being effective. It's not reducing the behavior because timeout in ABA terms is a punishment procedure. That means it leads to a decrease of the behavior. That's the whole purpose of timeout. Okay. So if a strategy is not helping, the answer is not usually to do it harder, longer, more. No, it's to step back and rethink the plan. This is where parents lack that skill. And that leads into a few important cautions. Okay. Now, I want to show you this video and you tell me, is this an appropriate situation to use timeout or not? So that's it. The kid came to his mom. She's scrolling on his phone. He slapped her on her face. So the video was cut, but there was a small slap from him first. Then she slapped him. Then he slapped again. She slapped him now even harder. Then he walked away and then she kept scrolling. What do you think? It's more like inducing fear in the child's mind. Okay. So remember about what we said about the whole um, relationship? Okay. So just due to time, I'm not going to give more time about this. So as you can see here, what happened, um, there was no connection from the mother. There was no correction. There was no skill building. So definitely timeout should not be used here. What should be used here, I mean, I'm not judging the mother. Like she could be exhausted. She could be tired. She is, you know, regulating herself by being on her phone a little bit. But this is where your emotional maturity needs to be. Yes, no replacement taught by mom. Definitely. So first we need to know, why did he hit her? Was it to gain her attention? Was it most likely it is because to gain her attention, and that's how she should be um, behaving, whether she's tired or not, whether she's exhausted or not. Okay, let's see the next one very quickly. So this is in different language, and this is in Arabic. But these two girls, they were doing some push-ups. This you will see now. They were just together. There was no interaction from the parent. And this one came to help, and it started. Still, the mother is not reacting. She's just not talking, nothing, and she's just leaving it. Okay. And then she laughs. All right. So, is this a good situation to put them in timeout? Just let's keep it short by only saying yes or no, and then I will tell you why it's if it's a yes and why if it's a no. Nusra, thank you so much for the highest engagement. You're the star of today's of tonight's engagement. Thank you. Yes, so definitely this is not the appropriate one. This is not the appropriate one. As we said, we go back to the table where it says appropriately when to use it. It doesn't meet any of these criterias. Now, this is the video that I want you to focus on. This mother is actually, you listen to it, then I'll explain. Okay. What do you think about this encounter? Rightly used. Okay. All right. Let's go back to these questions. Is the behavior intentional and within the child's control? Since only Nusrat is answering. Nusrat, what do you think? Did he intentionally and within his control not took the spoon and throw it in the garbage? There is no right or wrong answer. We're just brainstorming. Okay. Again, for the sake of time, I'm gonna move on. So, is the behavior intentional and then within the child control? Maybe, could be. I don't know if he can pick it up or not. So I don't have a uh, um, knowledge about his previous skills. Maybe. Have I taught the child what to do instead? So this is the mother question. Has she taught him what to do instead? She wants him to take the spoon and put it there. So that's more of a compliance. That's what she wants him to do, and following directions without any any thought of it. Uh, so if he doesn't pick it up, what to do instead? Okay. Am I calm enough to do this correctly right now? She seemed calm. She seemed that she was regulated, or that what's looked like. Is our relationship warm and reinforcing enough overall? Also, I cannot tell from this short video, so I'm not sure. Have I gotten training and support on how to do this? I also don't know. So I am a little bit skeptical of if she was trained or not. But from what I have seen from the video that she did here when she reached the timeout here. So she put him here and she said to him, sit here. Now, a couple of things can have happened. The kid can elope. He can run away. He can go upstairs. He can lie down and sleep. Uh, he can do a lot of stuff. And at this age, he doesn't know what he did. Like, what do you want him to do? Just listen to you blindly and without thinking, just because you told him put it. And there's a lot of stuff in this video happening, and I did this on Instagram as well. There's a lot of things, the way that she was talking, when she was talking. So, for example, here, the kid is clearly cannot breathe from the stress. I wouldn't talk and I wouldn't tell him to pick it up. Look at him. He's not ready to listen now. He's not ready to learn. And what does it mean, listen? And are you going to be good? What does that mean? Was there a definition of being good? Does he know what good means? Or behaving good? What does that mean? Okay. All right. So this slide is really about protecting the child and protecting the relationship. Timeout should never become a way for a parent to unload frustration. If you are too upset to do it calmly, it's better for you to pause, take a breath, and you regroup first, or give it to another person, to another adult that can do that instead of you. It also should not be humiliating. It's so public shaming, harsh language, long isolation, or anything that feels scary changes the whole experience for the child. And there's another key component is that not every child responds the same way. So you might feel that, yes, I ticked all the correct guidelines for using timeout, but the kid responded differently. So if the child becomes much more distressed during timeout, this is a very useful information for you to know. It means you need to reconsider your plan, not simply repeat your plan. And parents usually they need support to do that well, which is why the next slide is uh, it's very much important. Yes, no problem, Nosra. Thank you for reconnecting. Unfortunately, because it's only 1 hour presentation, we're a little bit limited with time. Okay, so this is a video that I commented on social media. You can check our Instagram page. I am not going to talk about it, also because of due of time. So you can, if you're interested, you can go to our Instagram page and you can see it. Now, this is the important slide. Most parents, they are not going to master timeout just by reading about it one time. Like any parenting skill, it gets better when it's explained, when it's practiced, and when you give feedback. So this is where we call it behavioral skill training, BST. So behavioral skill training does that. And that's why strong parent programs, they do more than just give out information and general guidelines on how to use timeout. They show parents what to do. They let them practice it and help them make adjustments. Making them help them make adjustments is the key word here. And this is important because timeout is simple in theory, but easy to do poorly under stress. Parents are much more likely to use it well when they understand why the steps matter and have rehearsed them before a hard moment happens at home. Same thing when, let's say, firefighters, they train themselves when things go bad, how to respond. Same thing. It's rehearsal, it's training, it's getting ready, building those skills. Okay, so let's see this sample caregiver checklist. Okay. You can also take a screenshot of that. So I would present this support tool, not a test. just support. So if a family marks several times as not yet, that doesn't mean they are failing. It means they have identified where the foundation needs to be stronger before trying timeout. So maybe they need a clearer target behavior. Maybe they need better definition. Maybe they need more positive attention built into the day first. Maybe they need coaching on how to stay calm or what to do if a child refuses to do something. So that is very helpful information for you. It helps families slow down and prepare rather than jumping into a strategy before they are ready. And just because they heard some parent coach say use timeout when your kid does this. So to make this feel more concrete, let's look at these two examples that show the difference between careful use and harmful misuse. So Maya is 4 years old. She hits her younger brother when she wants a toy that he has. Her mom, Danielle, has worked with a parent coach to implement a structured behavior support plan. Okay. So this example shows why calm structure can work. And that's what the research also supports. So Maya's mom is not being dramatic. She's not angry. She's not being like punishment. She has already decided what behavior leads to timeout. Okay. Um, which is hitting her brother. So she clearly defined it and she said, if you hit your brother, you're going to go for timeout. And she follows through in a very simple way and she reconnects right after. So, just as important, she notices and praises the next positive reaction. So, immediately praises the next positive attention, the next positive interaction between the siblings. And this is where this last step often gets missed, but it's the most important step, which is missing good things. Parents usually only pay attention most of the time to inappropriate things, not good things, not appropriate behaviors. And we need to shift that. Children need to know not only what stops access to attention for a moment, but also what brings positive attention back. So in this example, timeout is a very short interruption inside an otherwise supportive plan. So there is another supportive plan that is in place, and then they add a timeout to that. So the child is corrected, but the relationship stays steady. It wasn't affected. Now compare that with a version that uses the same label, but it's but is a very different experience. So Connor is a 5-year-old boy, and you can read this. He has a meltdown at the grocery store when his dad says he cannot have a toy. His dad, frustrated, that's the first cue, frustrated after a long day, he yells, "That's it. You're going to time out the minute we get home." Okay. Now, first of all, the response is delayed. Okay. The parent is angry. The child is left too long, and the moment turns into punishment. So 20 minutes. So dad, the threat is delayed by 45 minutes. Connor has no connection between the behavior and the consequence. And if you know anything about consequences, it has to be effective, it has to come immediately after the behavior, not after 45 minutes. So when they got home, the father is still angry and he sends him to his room with raised voice. Dad doesn't return for 20 minutes. So 20 minutes he was in timeout. He lectures Connor about his behavior and withhold dinner briefly. Connor is confused, he's scared, and increasingly avoidant of his father. That's everything we talked about when not to use it and when it's inappropriate to be used. So here he's learning that the adult is upset and unpredictable. I don't know when is he going to send me for that long for timeout. And this is exactly why definitions, they matter. So calling both of these examples timeout hides the difference between a calm tool and a harmful tool, between a good tool and a bad tool. Okay. Now, this that same need for this small details, it shows up also in conversation about trauma as well. So being trauma informed does not mean never setting limits. It means being more thoughtful about how a child experiences those limits. So some children need extra care, closer observation, and more support for the regulation before any consequence-based strategy makes sense. And research does not support a simple rule that timeout is always wrong for children with hard histories, but it also does not support using it casually. It's like a habit. So the right question is whether this child in this relationship, in this moment, can experience the response as brief, predictable, and safe. If not, another plan is probably needed. This is also why teamwork matters. Families do best when home, school, and helpers are not all doing different things. That's why we focus in ABA in generalization and maintenance across settings. So this is where we are headed next. So some recommendations for home, clinic, and school. Children benefit when the adults around them are broadly on the same page. Not the mother does something, the father does something else. The mother puts him in timeout, the father takes him out. That's not going to work. But that doesn't mean that every setting has to use the exact same words and the exact script or the exact steps. But it does mean that the overall approach should feel that it is consistent. If I hit my brother, I'm going to timeout. That's it. So that's the plan. How long? You will decide it. You will put a plan. If he hits his brother, he goes to timeout for whatever minutes, let's say 5 minutes, 3 minutes. And when he gets out, this is what you're going to say. This is what you're not going to say. This is the plan. So at home, that may look like building in more positive attention and using timeout only for clearly chosen behaviors. In a clinical setting, it means teaching parents by showing, practicing, and following up. At school, it means the staff should understand the difference between a brief behavior strategy and exclusion or punishment. No matter where you are, consistency across settings reduces confusion for children and gives parents more confidence as well. So, before we close, it's important to talk honestly about what research can and cannot tell us. So, these three studies, they did have some limitations, and those limitations are right here. Okay. So this is what the research could not fully answer about timeout. Okay. So some of these three studies that we reviewed, they rely on people's memories. And as you know, memories are not much accurate. And also memories can be shaped by time and by emotion as well. Some studies, they show patterns and connections rather than clear cause and effect. So it's not because he got timeout very hard in his childhood, he became this person. No. And not every research defines appropriate timeout in exactly the same way. So each of these three studies define timeout in a slightly different way. Also, that does not make the research useless. It just means that we should use it with humility. And the evidence gives us guidance. It doesn't gives us certainty. Parents, they still need to look at their own child, their own relationship with their child, and their own ability to stay calm and consistent. So with that in mind, here are the main points that I hope you and all the families, they carry with them after this talk. Okay. If I could leave you with something, it will be this. First, stay calm. You yourself, be calm. Okay. Calm and appropriate timeout is very different from angry frustrated, shaming, embarrassing, long timeouts. And second, the relationship around the strategy matters as much as the strategy itself. And third, timeout should never be your whole plan. It should never be your first line of treatment. It's not supposed to be used as a single tool or strategy. Children need teaching. They need connection. They need routines, and they need positive attention far more often than they need consequences. And finally, if timeout is making things worse, that is important feedback. Don't ignore that. It means pause, rethink, and get support. The goal is not to win a discipline argument. The goal is to help your child or your student to learn while keeping the relationship safe and strong. Okay, so I will close with the sources behind this presentation. These are the references and the resources. And thank you for being here and for taking this topic seriously. Parents are doing one of the hardest jobs there is, and most are trying to make thoughtful decisions with incomplete and often conflicting information, especially when social media came out. So I hope that this presentation gave you a clearer, steadier way to think about timeout and helped you feel more confident about what questions to ask before using it. So thoughtful parenting grows through reflection, through support, and through practice. Thank you again. And I would be glad to take questions or talk through how these ideas fit your situations or any feedback. Thank you. And also, please, you can follow us on Instagram, and that's our website.